Hey everyone, welcome back for another deep dive. And this one is going to be so interesting. I've always been fascinated by psychological assessment.
Oh, yeah.
You've given us a huge stack of stuff, including some pieces from the Handbook of Psychological Assessment.
Okay.
And we're excited to dig into it and bring you guys the highlights.
Yeah, it's interesting you say break it all down because that's a big part of what psychological assessment really is. It's all about understanding people,
Hmm.
right? Their thoughts, feelings, behaviors, and going beyond just tests.
Okay, so it's more than like filling in those little bubbles on a Scantron.
Exactly right.
Yeah.
So a psychometrist might be great at, giving those tests and
Yeah.
storing them, but a clinician, they're going to go beyond the numbers, and the tests are just one tool they'll use.
Right.
Like a detective would use fingerprints, but they also look at, what the witnesses say and what the crime scene looks like.
Yeah.
It's about seeing that whole picture.
I like that analogy. The clinician as a detective, so they're piecing together clues from the tests, interviews, maybe even a person's history.
Yeah,
And all of that is to help them answer very specific questions, right?
exactly. Those questions might be, about a diagnosis or treatment planning, or even something like figuring out the best career for someone.
Right.
And to do that, they need a pretty broad skill set.
So tell me about that. What kind of skills are we talking about?
Well, you need to know a lot about statistics, how reliable and valid different tests are. And it's not just the numbers.
Okay.
They have to think about how cultural diversity might impact testing and make sure they're using tests that are appropriate and fair.
I've always been curious about the interview process because it seems so straightforward.
Yeah.
But I bet there's a real art to it. I mean, can it really tell you as much as some of these, intense assessments?
You'd be surprised how much you can learn from a good interview. Think about it. You're seeing the person's thoughts and emotions, how they express themselves, and you're picking up on things that a test can't capture.
Hmm.
Their body language, their tone of voice.
But wouldn't an interview be pretty vulnerable to bias? The clinician's own, perceptions and ideas?
Sure. Well, there are different approaches to interviewing.
Hmm.
So a structured interview uses a very specific set of questions, so everyone gets asked the same things.
Right.
But sometimes you need to be more flexible to really dive into a person's unique experiences.
So you might start structured, but then go off script a little.
Exactly. A skilled clinician might start with open-ended questions so the person can tell their story, in their own words.
Yeah.
Then they might use more focused techniques like clarifying or even confronting, to kind of dig a little deeper.
Okay.
And a lot of clinicians use checklists to make sure they're covering everything.
It's a balancing act for sure. Well, we've got to talk about intelligence testing, those Wechsler scales. The WAIS and the WIS-III, those are like household names.
Yeah.
Is it all about that IQ score, or is there more to it than that?
Oh, it is so much more than just a number. The Wechsler scales actually measure different aspects of intelligence, so you get a profile of strengths and weaknesses. So you have separate scores for things like verbal IQ and performance IQ.
So someone could be like amazing with words, but struggle with like spatial tasks, and the Wechsler would show you that.
Precisely. And
Yeah.
then within those bigger IQ scores, there are subtests that measure even more specific abilities. Like there's one called block design that looks at spatial reasoning.
Okay.
So you might be great at puzzles, even if your overall IQ isn't super high. And then there's the WSI, the Wechsler Abbreviated Scale of Intelligence, if you need a shorter assessment.
Okay, let's move on to something that's always intrigued me. Personality tests, and specifically the MMPI. I feel like it has this mysterious reputation. What exactly does it measure and how does it work?
Yeah, the MMPI too, it's a really powerful tool for looking at personality traits and, potential problems. It has all these clinical scales that are designed to measure things like depression and anxiety and even more serious concerns like paranoia.
So if someone scores high on, let's say, the depression scale, does that automatically mean they're depressed clinically?
Right.
What about something like the psychopathic deviate scale? That one sounds kind of scary.
Right. A high score on any one scale, you can't diagnose from that alone. You have to look at the whole picture, all the scales together. And as for the psychopathic deviate scale, it doesn't mean someone's a psychopath like you see in the movies.
Okay.
It's more about, rebelliousness and having trouble fitting in with social norms, maybe not caring about rules.
But how do you know if someone's being truthful on these tests? Couldn't they fake good or bad to try to manipulate the results?
That's what's so cool about the MMPI too.
Mm.
It has these built-in validity scales that can catch inconsistencies.
Oh, wow.
So they help clinicians figure out if someone's trying to present themselves in a certain way or if their answers are genuine.
It's like the MMPI has a built-in lie detector.
Kinda.
It makes you think twice about trying to outsmart it. This is making me realize that We often judge people based on what they say, but what they do might tell a very different story. And isn't that where behavioral assessment comes in?
Exactly. Behavioral assessment focuses on what people actually do,
Yeah.
not just what they say they do.
Right.
It's about understanding how behavior is shaped by the environment. What happens before and after a specific action. We call this the ABC model: antecedents, behaviors, and consequences.
Okay, so walk me through that. Give me an example of how the ABC model works in real life.
Okay, imagine a kid who throws a tantrum every time they don't get candy.
Yeah.
So the antecedent is being told no to the candy. The behavior is the tantrum.
Uh-huh.
And the consequence might be that they get attention from their parents, even if it's negative attention.
Right, right.
So you can see how that chain of events, kind of keeps the behavior going.
And so by understanding that chain, you can start to figure out how to change the behavior.
Exactly. Maybe the parents could offer a healthy snack instead, or just ignore the tantrum so they're not reinforcing it. Behavioral assessment helps you see those triggers and consequences that are driving the behavior so you can come up with a plan to change it.
Okay, I've got to ask about something that has always blown my mind. Neuropsychological assessment. It's like you're peering into the brain. What kind of insights can these assessments provide?
Neuropsychological assessments are all about evaluating how well different parts of the brain are working. Things like memory, attention, language, problem-solving skills, that kind of thing. They can be really helpful when someone's had a brain injury or has a neurological condition.
So what kinds of tests are used in these assessments?
There are a lot of specialized tests out there. Some of the common ones are the Bender-Gestalt test, the WAIS-III of the complex figure, and the controlled oral word association test, or the COWA.
I vaguely remember the Bender-Gestalt from psych class. It's the one where you copy geometric designs, right? What does that tell you about the brain?
Yeah, you have to copy these designs. And it seems so simple, but it actually uses a lot of different skills. Visual perception, motor coordination, planning, and organization. If someone's had brain damage, they might have trouble copying the designs accurately. Maybe they rotate them or make the shapes distorted or can't connect the lines smoothly.
Wow, so even something as simple as copying shapes can give you clues about how the brain is functioning.
Exactly. It shows how even small changes in brain function can show up in ways that you can observe.
All of this is making me think about the ethical considerations with psychological assessment. We're dealing with really sensitive information, and the results can have real consequences for people. So how do clinicians make sure they're using these assessments in a responsible way?
You're hitting on a really important point. Ethical considerations are huge in this field. Clinicians have a responsibility to get informed consent so people understand what the assessment is for and how the information will be used. Confidentiality is super important too, protecting people's privacy and the sensitive nature of their information.
That's good to hear. We've talked about cultural sensitivity in testing a few times. How do clinicians make sure everyone's being evaluated fairly and that there's no bias?
Yeah, addressing test bias is crucial. It's not just about translating tests into different languages. It's about understanding cultural nuances and how those might affect a person's responses. Clinicians need specialized training, and they have to keep learning to stay up to date on the best practices and to make sure they're using culturally appropriate assessment tools.
Makes sense. It really highlights the importance of finding a clinician who's not just skilled with the test, but also culturally competent and sensitive to individual differences.
Exactly. Building rapport and trust is so important. A good clinician knows that each person comes from a unique background and brings their own set of experiences to the table.
We've covered a lot of ground today, from defining psychological assessment to the talking about specific tests and the importance of ethical considerations. I feel like we're just scratching the surface, though.
There's always more to learn, but I think we've laid a good foundation for understanding what psychological assessment is really about. And it's a journey of discovery, not about labeling people or reducing them to scores.
Speaking of uncovering more, we've talked about intelligence and personality tests, but our sources mention a whole bunch of other assessments. What else is out there?
Oh yeah, there are thousands of psychological tests, each one designed for a specific purpose. You've got tests that measure academic achievement, vocational interests, specific cognitive functions like memory or executive functioning, you name it.
So if someone was worried about memory problems, what kind of test might a clinician use to check that out?
One commonly used test is the Ray Auditory Verbal Learning Test, or RAVLT.
Okay.
The person listens to a list of words and then tries to recall them. It sounds easy, but it can tell you a lot about how well someone can learn and remember new information.
I'm guessing a low score doesn't necessarily mean there's a serious memory issue?
Right, the clinician would look at lots of factors, the person's age, education level, their overall health. whether their memory has changed recently, if they have any other symptoms.
So it's all about context, just like with the interview, it's not just the test score, but the whole story behind it.
Exactly. Another common memory test is the Whistler memory scale, which is actually a bunch of subtests that measure different types of memory, visual, auditory, working memory, and so on.
Right.
So you get a more complete picture of a person's memory strengths and weaknesses.
We talked about the Bender Gestalt as a neuropsychological assessment. Are there other tests that work in a similar way? They seem simple, but actually tell you a lot about how the brain is working.
Absolutely. The Bender Gestalt is just one example. Another one is the Rorschach complex figure, where the person has to copy a complicated geometric design and then try to draw it again from memory.
Interesting.
This task can show you a lot about visual perception, motor skills planning, and organizational abilities.
So if someone has trouble reproducing that figure, it could be a sign of some cognitive challenges.
It's possible they might struggle with specific parts of the task,
Yeah.
like seeing the spatial relationships in the design or figuring out how to organize their drawing. But again, a bad performance on one test doesn't mean you have a diagnosis. It's just a piece of the puzzle.
You mentioned the California Psychological Inventory earlier. How is that one different from the MMPI? They both sound like personality tests.
They are both personality tests, but they have different purposes.
Oh.
The CPI is mostly used for assessing personality in people who are functioning normally.
Okay.
It doesn't focus on psychopathology. It looks at traits like responsibility, self-control, tolerance.
So it sounds like something that could be helpful in everyday life, even if you're not struggling with any big psychological issues.
Exactly. The CPI is often used in career and educational settings to help people figure out their strengths and weaknesses.
Like a roadmap for self-discovery.
Exactly.
Okay, we can't wrap up this conversation without talking about the Rorschach test, those ink blot tests.
Oh, yeah.
They've always seemed so mysterious to me. What's the deal with them?
The Rorschach is a really interesting and complex tool. It's a projective test, which means it shows you ambiguous things like those ink blots
Uh-huh.
and then asks you to describe what you see.
Yeah, I can imagine people seeing all sorts of things in those ink blots.
Right.
What's the thinking behind that? What did those interpretations tell you?
The idea is that people project their own thoughts and feelings and experiences onto the ink blots, and that might reveal unconscious parts of their personality.
Oh, wow.
So it's a way to tap into their inner world, their perceptions and how they process information.
So it's like a psychological X-ray?
You could say that the Rorschach can give you insights into someone's emotional world, their thought patterns, their interpersonal style, but it's also pretty controversial.
Why is that? Is it because the interpretations are subjective?
That's one of the main criticisms. The Rorschach relies a lot on the clinician's expertise and interpretation, which means there's room for bias. There's also debate about its reliability and validity, how consistently it measures what it's supposed to measure.
So it's a powerful tool, but you have to use it cautiously.
Absolutely. The Rorschach isn't something you would use lightly or without specialized training. It's a complex instrument that requires careful thought and a nuanced understanding of its strengths and weaknesses.
It seems like with the Rorschach, more than maybe any other test we've talked about, the relationship between the clinician and the patient is so important. The person has to feel safe and comfortable enough to share those really personal interpretations.
You're absolutely right. Building rapport and trust is key for any psychological assessment, but it's especially crucial for something like the Rorschach, where you're asking someone to look into their subconscious and reveal vulnerable parts of themselves.
We've covered so much ground here, from the basic definition of psychological assessment to specific tests and the ethical side of things. But before we go any further, I have a question that's been on my mind. What does all of this mean for someone who might be considering getting an assessment themselves? What should they keep in mind?
That's a great question. The most important thing to remember is that psychological assessment is a collaborative process. It's not about a clinician judging you. It's about working together to understand your strengths and challenges and figure out a plan for moving forward.
So communication is key.
Absolutely. You should feel comfortable asking questions, sharing your concerns, and being an active part of the process. It's a partnership. You and the clinician are on this journey together.
What about choosing a clinician? What are some things to look for?
Of course, you want to make sure the clinician is licensed and qualified to do psychological assessments. But beyond that, you want someone you feel good with, someone who listens to you, respects your perspective, and creates a safe space where you don't feel judged.
It's like finding the right fit with any healthcare professional.
Exactly. And don't be afraid to shop around. It's okay to talk to a few different clinicians before you choose one. It's about finding someone you feel confident in and who understands your values and needs.
We've talked about how tests are just one part of the whole psychological assessment. How do all the different pieces fit together to give you that complete picture?
Think of it like this. The clinician is a detective trying to understand how you function psychologically. The tests offer clues, but so do the things you say, your behavior during the interview, your personal history, any other information you share. The clinician takes all of that and puts it together into a report that can help with diagnosis, treatment planning, or other decisions.
So the report isn't just a bunch of scores, it's a narrative. It tells a story about the person.
Exactly. A good psychological report should give you a deep and individual understanding of the person who has assessed it, takes into account their strengths, challenges, and life experiences. It's about painting a full picture, not just a rough sketch.
This makes me wonder about how the results of a psychological assessment are actually used in real life. What are some common applications?
Psychological assessments can be used in so many different ways. For example, they can help diagnose mental health disorders like depression, anxiety, ADHD.
Yeah.
They can also assess how well your cognitive functions are working, things like memory, attention, problem solving.
So they're not just used in clinical settings.
Right. You see them used in educational settings to identify learning disabilities or help students plan their academic paths, in workplaces to help people choose careers that fit their interests and abilities, and in forensic settings to assess things like competency to stand trial or the risk of someone committing another crime.
It's amazing how much you can learn from these assessments and how they can be used in so many different situations and for different goals.
That's what's so cool about psychological assessment.
Yeah.
It's about understanding people in a holistic way and then using that understanding to empower them in different areas of their lives.
This has been such a fascinating deep dive into the world of psychological assessment.
Yeah.
It feels like we've only just started to explore it.
We definitely have.
But before we move on, I have one more question. We've talked about all these different tests and how they're used, but I keep coming back to the human element. How does a clinician make sure that the person being assessed feels respected and understood throughout the whole process?
That's a crucial question, and it brings us right back to those ethical considerations we talked about. A good clinician approaches every assessment with empathy, respect, and cultural sensitivity. They create a safe and supportive environment where the person feels comfortable sharing their thoughts and feelings honestly.
So it's not just about giving tests, it's about building rapport and a real connection.
Absolutely. The most effective clinicians are not only good at using assessment tools, but they're also great communicators and compassionate listeners. They see the person sitting across from them as a unique human being with their own story, not just a set of scores.
This has been such an insightful conversation. I feel like I have a whole new understanding of the complexity and the human side of psychological assessment, but I know we have more to explore. What other interesting things are we going to learn about in our next segment?
We're going to go even deeper into the different types of assessments and how they're used in real-world situations.
Sounds good.
Be prepared for some interesting case studies and maybe some surprising things you didn't know.
I can't wait. Stay tuned, everyone, as we continue our deep dive into the fascinating world of psychological assessment.
And they realize that the assessment process can actually be therapeutic.
Mm.
Giving people a better understanding of themselves and helping them make positive changes.
Yeah, it's like the assessment can be a starting point for growth. That self-awareness is huge.
Exactly. And another thing to remember is that everyone is different. So there's no one-size-fits-all approach to assessment or treatment.
We've really gone deep into psychological assessment today. It's amazing how much there is to this field. It goes way beyond those tests.
Yeah, it's about understanding all the pieces of a person, their thoughts, their behaviors, their history, and figuring out how those pieces fit together.
Right. We talked about how those pieces are collected through interviews, observations, and tests, like the Wechslers, the MMPI, and even that super interesting Rorschach.
Right. And all along the way, those ethical considerations are so important, making sure the person feels respected, understood, and like they're a part of the process.
So for someone listening to all of this, what's the main takeaway from our deep dive today?
Well, the human mind is incredibly complex, and psychological assessments are valuable tools for helping us understand ourselves better. The key is using them responsibly and ethically, and that's what trained clinicians are there for.
That makes me think about self-discovery. Are there times when someone might want to get an assessment, even if they're not having any major problems, just to learn more about themselves?
Oh, definitely. Psychological assessments can be really insightful for personal growth and self-awareness. Like career counseling uses assessments a lot to help people figure out their strengths, their interests, and what kind of careers they might be good at.
That makes sense. It's like having a guide to help you explore your own inner landscape.
Yeah.
Speaking of landscapes, It sounds like there's this whole world of assessments out there, beyond the ones we've already talked about. What else can you tell us?
Well, we mentioned that there are literally thousands of psychological tests, and they all have a specific purpose. Some of them look at academic achievement, some focus on vocational interests, and others zoom in on specific cognitive functions, like memory or attention.
Let's talk about memory for a minute. If someone was having memory problems, what kind of test would a clinician use to figure out what's going on?
One that's used a lot is the Wechsler Memory Scale.
No.
It's a bunch of subtests that measure different parts of memory, like visual memory, auditory memory, working memory.
So it's not just about remembering a list of words, it's about understanding all the different ways that our memory works.
Exactly. For example, the visual memory subtests might have you try to remember images or patterns, while the auditory memory tasks might focus on remembering things you hear.
So by breaking memory down into these different pieces, the assessment can show you exactly where someone might be having problems.
Right. And that level of detail is really important for developing specific interventions or strategies to help them.
It's like having a personalized roadmap for improving your memory. You mentioned before that neuropsychological assessments can sometimes involve tasks like copying geometric designs. Are there other examples of assessments that seem pretty simple but actually reveal a lot about how our brains work?
Oh, there are tons. One that comes to mind is the Stroop color and word test. It's a classic assessment that measures cognitive flexibility and selective attention.
Okay, I think I've heard of that one. It's the one where you have to name the color of a word, right? But there's a trick to it.
The word itself might be a different color than the ink it's printed in. So, for example, the word "blee" might be printed in red ink, and you have to quickly say the color of the ink while ignoring the word itself.
That sounds hard. I can see how that would take some serious brain power.
It does, and that's the whole point. The Stroop test shows us how well we can stop ourselves from doing automatic responses and shift our attention between different things.
So if someone has a hard time with this task, what could that mean?
It could mean they have difficulty with cognitive flexibility or executive function, or it could even be a sign of attention problems, of course. But with any assessment, the results have to be looked at in the context of the person's overall profile.
We've talked about assessments that focus on cognitive functions like memory and attention. But what about assessments that look at our emotional world? Are there tools that can help us understand how we process and regulate emotions?
Definitely. There's a whole field of assessment focused on emotional intelligence, which is basically the ability to understand and manage your own emotions and the emotions of other people.
That sounds really important these days when we're constantly navigating complicated social situations and emotional stuff.
It is, and there are lots of assessments out there that measure different aspects of emotional intelligence, things like self-awareness, empathy, social skills, emotional regulation.
This is making me think about something we discussed earlier, that the assessment process itself can be therapeutic. Can you say more about that? How can just going through an assessment lead to positive change?
It is a cool concept sometimes. Just thinking about your thoughts, feelings, and behaviors in the safe setting of an assessment can actually help you grow. For some people, it's the first time they've ever really explored their inner world with someone who isn't judging them.
It's like you're looking in a mirror, but with an expert there to help you understand what you see.
Yeah, that's a great way to put it. And that process of self-discovery can help you become more self-aware, understand your strengths and weaknesses better, and even change your perspective.
It sounds like assessments can be empowering, not just about diagnosing problems.
Exactly. They can give you a framework for understanding yourself better, identifying areas where you want to grow, and setting goals for personal development.
This is making me realize that psychological assessments are about so much more than just labeling people or putting them into categories. They're about understanding how complex human beings are and helping people navigate that complexity.
That's a beautiful way to put it. It's about celebrating what makes each person unique and recognizing that we all have our own stories to tell, our own paths to follow.
We've explored a lot today, and I'm excited to continue this journey into the world of psychological assessment. What other cool things are we going to talk about in our next segment?
In our last segment, we'll look at some real-world examples of how psychological assessments are used. We'll see how they're used in different settings and how they can make a real difference in people's lives.
I'm already interested. Listeners, stay tuned as we uncover even more about the power and potential of psychological assessment. Welcome back to our deep dive into psychological assessments. We've been exploring all these fascinating tools that help us understand the human mind and behavior, and I'm ready for those real-life examples you promised.
Okay, I'm happy to share them. Let's start with something that a lot of people can relate to: career exploration. Imagine a young adult just out of college. They're feeling kind of lost and unsure about what they want to do with their life. They did great in school, but they haven't really found a subject that they're passionate about.
It's like that classic crossroads, so many options, but no clear path.
Yes, exactly. In this situation, career counseling could be a huge help. A counselor might use different assessments, like interest inventories, personality tests, aptitude tests, all to help this person understand their strengths, their interests, and what careers they might be good at.
I can see how that would be so useful. It's like having a personalized compass to guide you through the whole work world.
I like that analogy. Those assessments can help people discover careers they might never have thought of before, or they might confirm that they're already on the right track.
Okay, let's shift gears a bit. What about a child who's struggling in school? They're smart and they want to learn, but they just can't seem to keep up with their classmates.
That's where educational assessments can be really valuable. A school psychologist might give the child some tests to see how their cognitive abilities or their academic skills, their learning style.
Okay.
And those assessments can help figure out if there are any learning disabilities like dyslexia or ADHD, or they might pinpoint specific areas where the child needs more support.
So it's not about putting a label on the child. It's about figuring out what's really going on and finding ways to help them succeed.
Exactly. Based on what the assessments show, the school psychologist can work with the child, their parents, and the teachers to create an IEP, an individualized education program that's tailored to their needs.
This makes me think about how important early intervention is. The sooner you catch these things, the sooner the child can get the help they need.
Absolutely. Early intervention is key, and it's not just about academics. Assessments can also help identify social-emotional problems that might be affecting a child's learning or their overall well-being.
We've been talking about individual assessments, but are there times when assessments are used with groups of people?
There are, one example is in organizational psychology, where assessments are often used for team building and leadership development.
That's interesting. I can see how understanding different personality types and communication styles could help a team work better together.
Definitely, there are assessments specifically for team dynamics, like the Myers-Briggs type indicator or the Duzaki assessment. Those tools help team members learn about their own strengths and weaknesses and how their personalities interact with their coworkers' personalities.
So it's about getting everyone to collaborate and avoid conflicts.
Exactly. And it's not just about understanding how the team works. Assessments can also help identify potential leaders, figure out different leadership styles, and help people develop their leadership skills.
So psychological assessments are shaping the future of work.
They really are. As companies realize how important emotional intelligence communication and good leadership are, assessments are becoming really important tools for managing talent and developing organizations.
This conversation has really shown me how many different ways psychological assessments can be used. It's not just in clinical settings. They're making a difference in education and the workplace and even in personal growth.
They are. And as we keep learning more about the human mind, the field of psychological assessment will keep evolving too. It's exciting to think about what the future holds.
I agree. It's been so eye-opening, and I feel like I have a much better understanding of how powerful and versatile these tools can be. But before we wrap things up, I have one last question. We've talked about all these different uses and scenarios, but what's the most important thing for our listeners to take away from all of this?
That's a great question to end on. I think the most important thing is to remember that assessments are really all about understanding people, their strengths, their challenges, and their potential.
It's about seeing the person behind the scores, the story behind the data.
Exactly. And it's about knowing that these tools, when they're used ethically and responsibly, can help people grow, learn about themselves, and make positive changes in their lives.
Well, this has been an incredible deep dive. Thank you so much for sharing your expertise and for helping us understand this fascinating world of psychological assessment.
It's been my pleasure.
And listeners, we hope you've enjoyed this journey as much as we have. Remember, the human mind is vast and complex, and assessments can be such helpful guides as we try to understand ourselves and each other. Until next time, keep exploring, keep learning, and keep diving deep.